My name is Dr. Minka. I'm a dermatologist with West Georgia Dermatology, and I'm a consultant with Tanner Health System. Ever since I was old enough to legally hold a job, I had a job within the service industry. And I always felt like that was more personally satisfying than selling you something you didn't need. So what more valuable service could I provide you than ensuring your health and longevity? I honestly didn't know that dermatologists did as much surgery as they do in medical school. And I had visited my wife when I was an orthopedic resident and was enthralled by the creativity that's required to perform a beautiful flat closure. I was captivated by the fact that you're curing cancer in less than an hour. The patient's walking out cancer-free. I mean, without anesthesia, without any long intaking process or being admitted to a hospital. I was captivated by all of that, the power to be able to solve such an important problem that quickly. I chose to affiliate myself with Tanner Health System because of the strong reputation, the strong presence that they have in our community. My wife and I, we moved to Carrollton wanting to become embedded in that community. My son goes to school here. We take care of people that we live right next to, and that's pretty much whether we're doing the free skin cancer screenings at the hospital or we're taking care of local leadership. We wanted to be a part of the community that we live in, and that's why we chose Tanner. I treat patients of all ages. I treat simpler skin diseases such as acne and eczema, as well as more complex issues like cutaneous lymphomas and hidradenitis. We see it all here. I hope my patients take away from our visit that they can do all those things that make them happy. They can golf, they can fish, they can be outside with their kids, but trust me when I tell you how to do so in a safe manner. As much as I take pride in my surgical work, and I do love doing surgery, my patients and I both would rather they not get that skin cancer in the first place. I perform various types of surgeries, either within or beneath the skin. I remove lipomas, cysts, anything that is bothering a patient that is benign, as well as surgical excisions and curing of skin cancers such as melanomas, squamous cell carcinomas, and basal cell carcinomas. All of those procedures are in office with local anesthesia, and the patients walk out closed, bandaged up, and with instructions on how to best take care of that surgical wound that we want to look as good as possible. My approach to patient care is pretty simple. I try and treat every patient as though they're about to go out to dinner with my mother and father. You wouldn't want them telling your parents anything other than how well you took care of them in a time of need, and you want your parents to be proud of you. So that's as simple as that sounds. That's how I take care of my patients.